Ladies and gentlemen, if you can take your seats, we'll get started on time. Good morning to everyone. Good morning to all of you guys. It's a little strange for me to be talking to people's backs, but I guess this is how we're supposed to do it. My name is Joel Silverman. I am chairman of psychiatry at Virginia Commonwealth University, and I have had the honor to be able to serve the faculty, the citizens of our Commonwealth, and nurture the Department of Psychiatry for just a few years. I want to welcome all of you to the first VCU mini-university on mental health. So one day an idea came to me that since the legislature is critical in terms of making policy, and since we know that in the Commonwealth, as in the United States, as in the world, there are huge under-addressed issues related to mental health, that being able to give you all evidence-based information would be a useful thing to do. I want to thank Senator Deeds for his serious, persistent, loving commitment to this very difficult task. I'd like to recognize Secretary Dr. Carey for initiating a friendship with us and working with us to think about what we can do in terms of policy. Commissioner Dr. Melton is here, and I want to thank my big boss, President Rao, who really does understand the issues of mental health and has been supportive and helping us grow what we do. And I'll tell you a little bit later a little bit more about what an academic department of psychiatry actually does. So it is my distinct pleasure to introduce to you our leader, Dr. Michael Rao. Mike?
Thank you, Joel. Good morning. I really appreciate the opportunity to be here because I think this is probably one of the most important times that you will focus your energies on something that is very, very significant. Yeah, if you think about it, there are a lot of people who love being elected to office. There are a lot of people who appreciate the opportunity to sort of gain access to that zone in which they can govern, the opportunity to set policy and to be very thoughtful about how is it that we all sort of figure this out and live together in society. And so when I look at all of you, the colleagues who I just really have the honor and privilege of working with, I think it's an awesome opportunity, but it's also an awesome responsibility. You play a significant role in shaping society, a really, really important role in shaping society so that it works for all of us. And the fact of the matter is that I had this long conversation with my son just recently about mental versus physical health. And he said, Dad, I don't even know really why there is such an incredible distinction, other than for social reasons, between physical and mental health, because the reality is, isn't mental health just physical health? And I said, well, you and I know that, and that is absolutely true, and there's no question about it. By the way, his major in college is brain science, no surprise, right? And so I would just simply tell you that, if you talk to my colleagues who practice at our medical center or at any one of our locations, they will tell you that what we call the comorbidity of mental and physical issues is just tremendous. One of the challenges we face, of course, is that although we think that 1 in 5 adults deals with some form of mental illness, the reality is that may not be true. It may be a lot more than that. And I'll tell you why I say that. Because when I go to our student health center, or I go to any university student health center, do you know what the #1 issue is that students come in and present with? Anxiety, depression, often major depression. And these are things that were never discussed, never talked about, never thought about in their families. And so that's why it becomes so important for you as policymakers, as people with podiums, to really think about how your voice can make such a significant difference in people's understandings of how this all plays together. What is this human experience that we have that we continue to be mystified by? And so we're putting a significant amount of energy into this because, candidly, I think Joel and I have often said, if you could pick one thing that would be the most diagnosed health issue in human beings, it would undoubtedly be mental illness. And we're not quite there yet to the point where we really understand this for a number of different reasons, but there's no question that mental health also colors the outcomes that we have in terms of physical practice, in terms of treating and taking care of everybody at every level. By the way, I find it really interesting that the prevalence of what we call serious mental illness is actually much greater in younger people, but the treatment is actually much more prominent and prevalent in older people. I think we all know the reasons for a lot of that, but it really is something that we've got to give some serious thought to. So I want to ask you to think about this after we engage in these discussions. We'll share from my colleagues a lot of really important evidence-based information. I want you to think about the important places that you hold in society and the opportunity that you really have to help families be serious about considering mental health as a part of overall health in a human being. I cannot begin to tell you how heartbreaking it is for us to see some of the things that we see, the lives that are lost. Some of them are addiction-related, a lot of them are not addiction-related. Some of them are suicide-related, and some of them are not suicide-related. The creativity that's lost. You know, the Rand Corporation said that if every company invested $500, just $500 in every employee's mental health, that it would actually pay for more than itself in terms of the output that an employee, the productivity that an employee would bring back. And so we are your partners. That's why we're here. I'm very proud of Robin, very proud of Joel for putting this together. They've done a wonderful job of bringing some of our best colleagues to the table. There are a few things that I'm sure are not on the top of mind in terms of VCU. You are VCU, by the way. You created VCU. You continue to support VCU. For that, we are very grateful. And this is an area that we have invested heavily in. The neurosciences are absolutely, positively one of our top priorities. Our Dean of Medicine has made this a top building priority. And we as a university are going to do everything that we can to try and fulfill that commitment. And why would we do that? Because we're in the top 30 in terms of National Institutes of Health funding for the neurosciences. We're in the top 3 in the country in terms of addiction and related research that we do. Imagine how important that becomes right now at a time when we have more deaths than we have ever had related to addiction. And a lot of it is because of what we do, which is medicine. And so we're very proud to partner with you. I also would be remiss if I didn't thank you for your support of our medical center. We are your safety net hospital. We are you. We are pleased to be you and represent you well when we refuse no one care at VCU. We've had huge gains. My top priority has been to significantly improve the patient experience and patient satisfaction. And in the last 10 years, we have actually increased that 10 percentage points. And I'm really, really pleased. And I couldn't have done that without my colleagues, my provider colleagues who make all of that happen. And in the next few years, you're going to see a lot of what we're doing to try and improve the patient experience show up in very physical ways. One is on your screen. We just finished the new Virginia Treatment Center for Children, which is something that we're all very passionate about, because if we can treat and provide care to people when they are early in their lives, it prevents a lot of the kinds of issues that otherwise we will deal with in their lives as adults, if they make it, by the way. I should put that, make that clear. And I am trying to be dramatic because this is a very dramatic topic. But what you'll see at the medical center is the rise of the kind of standard that you should expect, the kind of standard you see at places like Mass General Hospital, and that will all happen right here in the Mid-Atlantic. I can't thank you enough for being wonderful partners. I really, really appreciate the time that you're putting into this today, and I hope that we can imprint in your minds a sense of that mental health is as important, if not more important, than any other part of health, and when we consider the human condition. So thank you for making the time to spend on this. I think you'll be very, very pleased with what you hear from my colleagues, and I look forward to some wonderful outcomes, and we will continue to be your partners, arm in arm, as we go forward together. Thank you.
Thank you, Mike. You can understand why I smile when the university president endorses so strongly what we do. It's my pleasure now to introduce my partner, Dr. Robin McDougall, who's Associate Professor of Criminal Justice, Director of the Center for Public Policy at the Wilder School, and one smart, energetic individual. Robin?
Joel, thank you. And I just want to take a few minutes to thank you all for having us here. In the Center for Public Policy, we truly do believe that being able to ground good research and giving the opportunities for our faculty to be able to engage with policymakers is how we make the best policy for the Commonwealth. And so being able to partner with Dr. Silverman and the Department of Psychiatry has really allowed us to take our two areas in public policy and in mental health to address what we think is a pressing issue in the Commonwealth and around the country. In front of you, you guys have a copy of our most recent summer public policy poll highlighting the mental health questions that we did in this summer's poll. And you will see one of the questions talking about when people think about school safety. One of the biggest issues that across Virginia residents say is that mental health should be a core responsibility of what our public schools address, because the mental well-being, as Dr. Rao said, is as important as the physical well-being of our children. And so we just wanted to thank you for the time today, and I'm very excited for you to hear from our colleagues talking about truly impressive research that I really do think will have a great impact on our policy conversations and on policy opportunities as we move forward into the 2019 General Assembly session, which fortunately or unfortunately feels like it's right around the corner. So thank you for your time this morning.
So I want to share a personal note with you. This morning over breakfast, I said to my wife of 48 years, I said, Phyllis, in your wildest dreams, did you ever imagine that a simple doctor from Kansas, me, would be addressing members of the legislature? And she paused and looked at me and said, dear, you're never in my wildest dreams. So that creates some humility, right? And we all have to have humility as we approach massive problems. The picture that I have for you is the new Virginia Treatment Center for Children. VTCC is a division of the VCU Department of Psychiatry. We wouldn't have this building if members of the legislature hadn't come together across party lines to do this for children. And I want you to understand first that 40% of our inpatient kids come from out of the Richmond area. So this is a statewide facility. We're the only facility that takes kids as young as 3 years old. And sometimes people look at me and they say, how can a 3-year-old get mental illness, be depressed, want to die? And the answer is 3-year-olds can get kidney disease, 3-year-olds can get heart disease, and 3-year-olds can get brain disease. Our concept in building this building was a ski chalet. And if you guys have ever seen a ski chalet, maybe you can see it. Color, wood, stone, glass, okay? Nobody wants to bring their kid to a child psychiatry hospital. But if you have to, you don't want it to look like a sterile box. You want it to be safe and beautiful, and the architectural difficulty was how to do the two at the same time. And within this facility, we have 32 inpatient beds. We have 19 outpatient offices, including a special suite where pediatricians and child psychiatrists can work together with kids who may have diabetes and depression or other kinds of illnesses that cross the boundaries. We teach nurses, medical students, child psychiatry fellows who hopefully will remain in the Commonwealth, and we do research in this facility. So I thank you for funding this facility. It was a challenge to figure out how to do it, but I can tell you unabashedly that Virginia has the best child psychiatry facility in the nation, if not beyond, and you're looking at a picture of it. Now, I just want to say a few words before I introduce our speakers about academic psychiatry and what we do. We have 4 missions. One is clinical, one is teaching, research, and then advocacy, putting on programs like this that teach people evidence-based information. So when you think about what we do, clinically, we take care of patients. I am a clinician. I take care of patients almost every day. And if any of you want to make referrals, give me a call. My cards are sitting out there. In 2018, VCU Psychiatry had almost 2,000 adult inpatient admissions. We took care of over 1,000 kids from Virginia on inpatient. We had more than 36,000 outpatient visits, as well as visits to the emergency room, consultation with patients in the hospital, and substance abuse consultations. Our outpatient new Motivate clinic, which you are going to hear about in just a few minutes, those numbers are embedded in the outpatient visits. So we stay very busy doing what doctors do, taking care of sick individuals. We also teach, and we don't just teach people who want to be psychiatrists, because if you have breast cancer, you want your surgeon and your oncologist to understand that that impacts emotion. It impacts how spouses get along with each other. It impacts how the children feel about themselves. So we teach nursing students, medical students, people who are going to become surgeons, internists, pediatricians, because everyone in the House of Medicine needs to understand how to recognize mental illnesses because, as Dr. Rao said, they are so hugely common and can have such devastating impact on people's lives. Now, we do research, and the reason we do research, the first thing I will tell you is the treatments in psychiatry today are as good as the treatments in the rest of medicine. And that's evidence-based. They're not perfect. But we got to do better because the state of the art today is nowhere near good enough. And so one of the serious moral, ethical commitments that we have as physicians, as citizens, you as legislators, is to push the envelope so we can understand how a person's genetics and what happens to a person in the environment, how they interact. I am super proud of the fact that our Department of Psychiatry out of about 200 academic programs in the country, has these kind of outstanding rankings in terms of the research we do. And I am happy to tell you that when the new research rankings come out around January, we're going to be doing even better than this. Our faculty publish a lot, present, and do things like this meeting today where they present scientific information. Advocacy is the last thing that we do. It's our job to get the word out. And so the message that I want to leave you with is, as Mike said, the current prevalence of mental illness is about 1 in 5 lifetime. So you think about the number of people in this room and think about the number of people here who have already had problems or are going to have problems in the future. The World Health Organization says in 2020, depression will be the major cause, the second major cause of disability worldwide. And of the top 10 illnesses that create disability, depression, anxiety disorders, substance abuse are in the top 5. As Dr. McDougall said, the survey shows that Virginians are starting to get it. So instead of saying, well, mental illnesses aren't real, people are just feigning them for whatever reason, people are understanding these are real brain diseases. They make a difference. Virginians are getting it. And I have to tell you, I never thought I would live to be able to say that stigma is getting better. The last thing I want to tell you is this. Good outcomes in treating mental illness are really possible if you can access care. And that's the critical issue. Great treatments are there, but if you can't get to them, it's kind of tough noogies, too bad. So part of our job, producing new doctors, nurse practitioners, part of your job helping us do that is to create access. And it's not just traditional access. We're doing telemedicine. We're using cell phones to treat people. There are all kinds of innovative ways to increase access. So I thank you for listening to that. It's now my pleasure to introduce my boss, Dr. Peter Buckley. Dr. Buckley is Dean of the VCU School of Medicine, Executive VP for Medical Affairs in the health system, and a professor of psychiatry. First time in my career I've ever had a boss who was a psychiatrist. The good news is I don't have to teach him what I do. The bad news is he knows what I'm supposed to be doing. So that's a little tough. Dr. Buckley is a world-renowned psychiatric researcher. He has extensive experience in public mental health and workforce development, has published over 300 things in the literature, and is going to talk to us today about workforce development and what some of the solutions may be. It's my pleasure to present to you my friend and boss, Dr. Peter Buckley. Peter?
Thank you, sir. Good. Are you going to advance the slides, or how is that going to happen? Great.
Oh, yes.
Please.
Yes, Delegate Ranson has a question. We can, whatever you all would prefer, we have time for questions at the end so that you hear all 3 presentations, but if you'd like to ask the questions between presentations, we want this to be most beneficial for you all. What would you like? Okay,
Okay.
this one is yours, sir.
Delegate, if it's a hard question, can we give that to Dr. Silverman?
If it's a question, you might want to ask it now.
Yes.
Sure.
We are, it's
This
absolutely.
is very fluid. Joel, do you want to?
I don't know, let's see what the question is.
My passion, the young people in the school. And so I'm hearing that the number one issue are the students, and they have anxiety, depression, and then I hear you say access to care. What about those young people that are fearful to say, I have anxiety, I'm depressed, and they don't know how to ask for help? And they're in high school. They're scared to say, I have anxiety. They're scared to say, Mom, I think I'm depressed, or Dad, something's wrong, I have anxiety. Or they don't even know they have anxiety.
So I think you're making an excellent point, and your point is that there are two paths that access gets blocked. One is if you want help and you ask for it, but you can't get to it. But the second that you're pointing out is, what do you do if someone is afraid to ask? And I think that that's an educational issue that needs to be addressed in multiple ways. Addressed in the home where parents are talking to their children. Addressed in the schools. That's okay for school teachers to be able to talk in a class about health, about how mental health is part of health, and how treatment makes a difference. And then I think the media also makes a difference. So every time Peter and I have an opportunity to talk to the press or to do a little snippet on TV to communicate the message that mental illnesses are treatable, that the people who get treatment are the people who do well, who don't crash, we try to get that message out. So I think we need to think about multiple ways of communicating to young people and to old people that it's an illness. And if you have diabetes and you don't take care of it, your life is not going to be long and it's not going to be good. And the same is true if you're abusing substances, the same is true if you're depressed. So I think your point that it's not just that there aren't enough doctors and clinics for folks to get to, but your point that there are folks out there who are still scared to ask for help. Youth organizations. We work very closely with the Cameron Gallagher Foundation. Cameron was our patient. And the purpose of that foundation, Cameron's life objective before she died, was to communicate to kids that getting help is the right thing to do. So there are multiple avenues, and we've got to touch them all. Thank you for that question.
Dr. Silverman, thank you very much. One statistic you showed I was very surprised to see and very struck by. So your department had 41,000 admissions and only 600 consultations for substance abuse. So is that because VCU just has an incredible filtering system through the emergency room physicians and your addiction medicine folks and so forth, so that they don't therefore consult your department? Or why is it that so few of your interactions actually were substance abuse folks?
I'll pull it right up for you.
I'll show you the numbers and answer your question in just a sec. It's just the way the numbers got put together.
Okay. So I presume that then maybe this answer, Dr. Silverman, I don't want to belabor it, but does...
No, I'll show it to you in just a sec. Yeah. So the substance abuse consults were in-hospital consults. The outpatient visits included substance abuse as well.
Okay.
So those two things went together. plus the visits to the ER and the consultation liaison service were also significantly
Okay.
related to substance
All right, thank
abuse.
you,
So
sir.
it's just the numbers.
Can I ask a question? The Children's Hospital, when did it open?
The hospital opened last year.
And the 32 beds, are they new beds or they replace existing beds?
Both.
How many new beds?
I think we have 10 new beds.
Did they replace 22?
Yeah. And again, there is room on the campus to build an additional 16 beds if the funding is available. So we've been sequentially opening the beds, and as soon as all 32 are open, they're going to be filled because the need is so huge.
Well, you know, we only have, I think, 48 beds in Stanton, Children's Hospital there, and they're full just about all the time.
Yeah.
Something that troubled me for a long time, pediatric beds, pretty rare.
Yeah, and it's hard if you think about having a suicidal kid. I mean, as a dad, having a kid in trouble and not being able to get him help, that's tough.
I just want to add, I mean, I thought I heard you say that you're serving 40% of the kids.
I'm saying that 40% of the kids who come to our inpatient service come from outside of the Richmond area.
Yeah, and I think that that's good, but that's also bad.
Sure.
Because when you're a kid, where's the parent? I mean, the parent has to come down here, and you're separated from your families in some cases. I came up here from Arlington, and I was talking to one of my constituents that we're trying to get our local hospital to add some beds, pediatric beds, in that area, because to your point, Senator Deeds, you're sending your kids to Stanton, or to VCU, and that's an omission, I think, from us, is to do a better job with making sure that we take a regional approach to making sure there are beds available for kids.
It's absolutely correct. For that to succeed, you've got to have doctors in the region, which is another problem. But one of the things that we have done when we designed this facility, and anytime, Senator Deeds, you want to hold a commission meeting in the facility, we'll show it to you.
I've been to the facility, before it opened.
So in each patient room is a single, so we're not double bunking kids. And number two, each room has a 7-foot window seat for the kid that turns into a bed for a parent. And in contrast to the national standard, which is your visiting hours are from 2 to 6 in the afternoon, at our facility, parents can come and stay with their kids 24/7 as long as it's not an abusive parent. So we have special showers for the parents. It doesn't replace what you're talking about, having something close to home, because if a parent comes and stays with the kid, maybe they're not getting to work, maybe they're not taking care of their other kids. But years ago, the legislature in the code identified VTC as a statewide facility. We're doing telemedicine statewide. And we see ourselves as serving the Commonwealth, not just serving Richmond. Thank you all for your questions.
Doug Watts has a
We've got
question.
one more question, Joel.
Once we get started.
I love it. I love it. People who don't ask questions aren't interested. Delegate?
Let me preface my question by saying it's not just that I'm a skier, but that decades ago, reading the book Man's Search for Meaning, where a psychiatrist survived Auschwitz in part by continuing to apply his mind to why
Yes.
people survive, that there's an anecdote in the middle of it about a woman saying, as long as I can see that tree, I know that somehow sanity is out there. And it was an anchor for her. So this is all by way of preface. There's a lot more I could say about the effectiveness of your design where you can see outside the walls, where you can see something that is you've seen in your own yard, et cetera, that cloud, that sun. Now, the question, how did you manage to get that enlightened design? Is it a combination of funding that allowed you to go beyond the state minimums, construction cost per square foot requirements?
We worked really hard and long at the design. We had architects from Europe helping us understand what the best facilities were like in Europe. We got on an airplane and identified the best facilities in the United States and went to figure out what we could adopt from them and how we could beat them.
But how did
We
you
had
fund
to-
it after you got all this enlightened input?
You guys funded it.
We funded that per square foot construction?
You funded that. Now, we were very careful about how we used the money. And I'm very careful about how I use money.
But there were private dollars involved as well.
We went out and raised private dollars.
Okay.
But basically, you funded it. We worked really hard to do it well. And I'll just tell you a brief thing. I'm a downhill skier, and I never worry about work when I'm worrying about dying. I'm going to give you Dr. Buckley.